I talk a little bit because that's the first time I saw that case, and I would probably treat that with a posterior only or a front back with perc screws. That being said, this is an interbody session, and I asked myself what I want out of my interbody. And what I need out of my interbody, want out of my interbody, is essentially three things. If I feel the need, I need extra surface area for fusion. If I feel the need, I need, particularly in deformity, perhaps a little bit of looseness so I can get better correction. And if I feel the pain source is the disc, I want to obliterate the disc. And that's essentially it. I use allograft bone, so germane to this talk, that is my disclosure. And this was going to be essentially a one-slide talk when you asked me why, because this is why. This is the cost in our hospital. It's very simple. My titanium cage, this is basically interbody from front or back, $6,800. My charge to my patients, $10,000 per level. My peak A-lift, it goes down a little bit, but still frightfully expensive. If I use industry allograft, and so if I do a T-lift, I will use typically Nuvasive or Stryker, or something that I can, it's got a nice mounting system I can manipulate a little bit, but it's not cheap. It's still over $3,000 a level. Industry A-lift's a little bit more variable, depending on, it's interesting to me, they actually charge per size, which I'm like, okay, it's a little bigger, it's another millimeter or two of bone, that costs more, but here's my go-to. It's to take my femoral shaft, so it's a 150 or a 50. It's fresh frozen. Literature really does favor fresh frozen